Assalamu alaikum. I'm Dr. Sayeed. Today I'm discussing on MRI-CT Neuroradiology, and think I can make an serial videos on the neuroradiology. Today we will discuss in a brief about the method of doing the MRI-CT when we are doing the scanning technique, the CT. So usually we keep the patient in supine position, and we take the scan, and we started from the base of the skull, uh, from the base of the skull, and it is called the nasomeatal line, and parallel to the nasomeatal line there is another line. It touches the vertex of the skull. So in between this area we can make a slice. It is called the scan interval. For the adults we make it 10 millimeter, and for the children we make it 7 millimeter, and for the infant we make it 5 millimeter. Usually we do not try to give any gap in between this space, so that we can get all the structures in the scan. We know that in MRI we can make a slice for the brain, this type of slice, which is called the sagittal view. And in the sagittal view, uh, usually we started from the base of the skull, started from the foramen magnum, so that we can get all the structures from the down to the top, and we goes from down to the top and take the scan up to the vertex. And in this technique, and this slice, usually we take the thickness 5 millimeter with or without taking any interslice gap. Sometimes we are getting some special type of line, like you can see this blue line. And if you see this blue line, the main thing is that it can divide it. You can show some special structures. If you see this axial view, you can see just the behind the cerebellum, you can see a little portion of the occipital lobe. Here, this axial view, you can see the occipital lobe, and this is the cerebellum. So this type of structure usually we are not taking in the MRI. Usually we are taking the MRI in such a way so that the occipital lobe and the cerebellum will not overlap each other. When we take the slice, usually we started from the base of the skull and goes up and up and up and it goes up to the vertex of the skull. So we started from our left side, it is the base of the skull, then goes a little bit up and up, so that we can get all the structures slowly. So this is the technique to take the MRI. And if you know the sagittal structure, then you can understand which line will show which type of structures. In the MRI protocol, usually we touch the some special types of MRI. The axial T1, axial T2, axial FLAIR image, and sometimes the sagittal T1. The axial T1, usually here we can see the CSF or fluid. It's a black color. The gray matter is gray and white matter become white. So this is taking only to see, mainly to see the normal anatomical structures. And the axial T2, usually we are taking these things to see any pathology. Here the gray matter becomes white and the white matter become little bit darker and the CSF become white. Very easy to see the any pathology in the T2 axial or T2 sagittal. But the special type of view, it is called axial FLAIR or FLAIR image. FLAIR means fluid attenuated image. So here what we are doing to differentiate from the T2, we are taking a special type of image. It's called FLAIR image. It is just belongs to the T2, but the difference is in the T2 image the fluid or CSF is white, but here the CSF is black, so that we can understand the differentiate the pathology, whether it is due to the tumor or fat or lipoma or the fluid. Previously we are using the different types of T2 image, uh, proton image, we call it proton image, but nowadays we are using the T2 image. And if you want to see the T2 image, you can see that there is an pathology, but for the T2 image the CSF is white, so you cannot differentiate that pathology from that CSF. So if we are doing an FLAIR image, you can see the fluid in the FLAIR image become black. The T2 image it is white, but the fluid in the T2 FLAIR image it is black. So when it is black, the background become change and you can see the sclerotic area or MS plaque in the brain very nicely. It looks like a white image. So this is the benefit of the FLAIR image above the T2 image. There is another things. The value of MRI image, I can explain it in this way. The T1 image, T2 image and the FLAIR image, you can see here is an recent infarction and here is an old infarction. In a T2 image it is very difficult to understand what is the recent, what is the old infarction, but in the T2 image the old infarction become white, but still you cannot understand it is the it's a recent image, you cannot understand these things clearly. So we can do the FLAIR image and you can understand the FLAIR image. The old infarction it becomes the black and the recent infarction it becomes white. So in the FLAIR image it is totally it can be totally, it is easy to distinguish totally that what is the old infection and what is the recent infection. In the FLAIR image the recent infection become white and the old infection become black. So this is in a nutshell about the MRI, and we will continue the classes. I think you will enjoy the other classes just like these things. So I'm saying that I'm not a neurologist, but as neurosurgery is my subject, so I think that it will be very beneficial for the new students and the new doctors. So if you like it, so don't forget to subscribe my channels and please share it to others so that everyone can benefit from these videos. Thank you very much for being with us.